Every February, people wear their red and go red for women. This national campaign by the American Heart Association spreads awareness about heart disease in women, and it may surprise people to know that heart disease is the leading cause of death for women. I sat down with Angela Smith, a registered nurse and the director of the stroke clinic at Holyoke Medical Center, to learn more.
It started in 2004, and it was just a clever way to bring recognition to women in heart disease. So the Go Red, wearing red as we are today, Heart Month, it's another segue into that whole red campaign, and it's just bringing awareness that heart disease is the #1 killer of women.
And I think so many people don't realize that. There are so many misconceptions about that. Can you talk a little bit more, about that number? And I'm sure you run into people that are equally as surprised.
Yes, and as the coordinator for the stroke service, heart and stroke have the same risk factors. And it's important for me to educate the public as I'm doing today, but letting them know that there's the risk factors are what put you at that level of where you need to be about getting care for your heart disease and partnering with your doctor. So is it your high blood pressure, smoking, high cholesterol, diabetes? Those are like 4 of the main risk factors for stroke. And it's just recognizing if you're at risk for any of those factors that could then contribute to heart disease for yourself.
Talk a little bit about the high blood pressure and what that does to the body, and if people are controlling it through medication, is that another way?
Yeah, so when you have high blood pressure, it's a way that if it constantly is elevated, it really has a way of damaging the lining of the blood vessels itself. So it's almost like you're beating up the blood vessel from the inside out, just pounding and pounding. So instead of the blood vessel being nice and smooth and have a wonderful surface when the blood pressure is controlled, it literally can damage the blood vessel and make it roughed up, and then you can build up cholesterol plaques, you can have cracks in the blood vessel, it narrows, it becomes less pliable. Blood pressure, you want it to be very pliable, and then with high blood pressure you develop what's called atherosclerosis, and it's really hardening of the arteries. So it's really damaging your blood vessels with the high blood pressure. That's what diabetes does. The sugar also has a way of damaging the lining of the blood vessel. Cholesterol builds up plaques in the blood vessel. Smoking also has irritants in the nicotine, damages the lining of the blood vessel.
And what are the symptoms for women?
So the symptoms for women, there's similar symptoms as for men, which is the heaviness of the chest, crushing chest pain, an elephant on the chest, shortness of breath. You can have radiation into the jaw and the neck. But with women, it can be sometimes overwhelming fatigue where you just cannot get out of your way. As we had a lady last year, she couldn't even go to the closet and pull out her vacuum. And what happens with heart disease is you get the symptoms with activity, and then it's relieved with rest. And then you can do something again, and you'll get short of breath or have this pain or this nagging, something that comes over you, and then it goes away with rest. So people tend to minimize it. Men and women tend to minimize it, but mostly women, because the symptoms are more vague.
Right, and I think a lot of people, as far as calling 911, you don't want it to be a false alarm.
Correct.
You don't want, you have a household to run, you have kids to run here and there, or maybe you're a grandmother, and you don't want everybody to turn and now help you. Like, when do you call 911?
Well, when you really have this overwhelming sense of that something is really wrong, you know your body. Sometimes people will have indigestion, that's a coming and going, and it's something that you've had for a long period of time. But these are symptoms that develop more like rapidly and more over a month or so. So something all of a sudden has happened in the body where that blood vessel was functioning well and blood flow was going through okay, and then all of a sudden there's a compromise there. There's something going on where you need to see your doctor and have, an echocardiogram or a stress test, or, letting them know what's been going on with you.
And obviously you don't want to start like this, big exercise program, but exercise is an important component as well.
Oh yes, it's all the lifestyle. Diet and exercise, hands down, are the most important thing you can do. So you try to lead by example, and you want to eat well and move, and the exercise really provides blood flow to all the parts of the body that needs it. So it really enhances your circulation. It kind of brings blood in, pulls blood out. So, it's important for people to exercise.
And I think sometimes when you look at people who you've seen have a heart attack, you're like, wow, they look like they're in great shape. Are there certain things that you bring up with your doctor, and will a yearly physical kind of pick up some of the problems?
Yes, it's important to keep like a little pad next to your table somewhere, and when you feel different than your normal self, you should jot those things down and discuss those items with your doctor. Obviously, they should know if there's any family history, because that's something that's out of your control, but 80% of the time, there's really stuff that you can do together. If you can't exercise an hour or 30 minutes, just do 20 minutes of something even, and you'd be surprised how much better you do feel. And then we talked a little bit about the stress. And stress, people are so stressed out now, and what happens is when you're under a lot of stress, you're under that fight or flight. Right. So what happens is your blood pressure tends to rise, and then what happens is it starts to damage those blood vessels. It can also raise cortisol levels in your body, and it increases your blood sugar. So here you are now under stress, and you're using those two other risk factors contributing to the heart disease.
And that is hard to manage, for families. If there's a work situation, I mean, how do you advise people to really pay attention to that? Because they might say, listen, I don't have time for this today. I have to get through this day.
And sometimes they just have to stop for a minute and just close their eyes and count backwards from 100 and just relax for a minute. Even if it's for literally 60 seconds, it can de-escalate what's going on in your body. Just find little small minutes to coping. Turn off your car and just kind of close your eyes for a minute, and now say, okay, I'm ready to tackle this.
And when you go for your yearly physical and they do blood work, that'll typically pick up if there's an issue that you're having.
Yep, it'll check on your cholesterol, your blood sugars. The range for blood sugar is a little narrow, 70 to 100, and you want to make sure you're in that if you're fasting. And the cholesterol also tells the tale. All your LDLs, which is the lousy or the large lipid, you want those under 100, or just different numbers that you can really know what you should be, and then you can work with the doctor on those numbers.